Hello, Brad Baldwin here, licensed acupuncturist in the beautiful city of Austin, Texas. Now I wanted to do a quick video blog here on something I've been seeing quite a bit in the office lately, and that's headaches. Now headaches are one of the top health complaints here in America. Millions of people suffer from chronic headaches here in the US, and that usually involves someone having at least one headache a month or having 2 to 3 every week, which that's abnormal. That's not normal at all. So if you're having that, that's not the normal for you. A normal headache is 2 small headaches a year that go away without the help of any kind of aspirin, Tylenol, or pain medication. That's the definition of a normal headache. So if you're having more than that, it's abnormal. Now there are 3 types of headaches. I'm going to talk about 3 types of headaches. Tension headache, migraine headache, cluster headache, and of course there's sinus headache, rebound headaches, which are headaches due to taking too much pain medication, and headaches due to trauma. Now all headaches have different triggers. They don't just have one thing that causes them, but there are some similarities in what can cause them, and those are going to be tension, stress, muscle spasms, constriction of blood flow or constriction of and constriction of the blood flow in the head. Now the first headache I'm going to talk about is a tension headache. This is the most common headache in the United States. It feels like a constant ache or pressure around the head, temples, back of the head, and in the neck and shoulder area. Now these headaches usually are the ones that people take aspirin for and go about their day. These headaches don't usually bother someone's normal routines, but they're usually brought on from tension, stress, tiredness, fatigue in the eyes. Even a good night in town can cause these kind of headaches. Now the next one I want to talk about is a migraine. Migraines are a one-sided headache, usually start from the back and make its way up to the eye. They usually are sharp, throbbing pain. They can be moderate to severe. They can interfere with people's daily routines. Most of the time people want to go home, lock themselves in their bedroom, black out the windows so no light comes in, and want no sound because that makes the migraine worse. Sometimes people get nausea and vomiting with these headaches, and they can last up to 4 to 72 hours, which is a large chunk of time to be laid up and not enjoying life. So definitely, if you're having those, I'm sorry to hear that. And lastly, I want to talk about a cluster headache, and these are headaches that usually affect men more than women. They are a recurring headache that occur in groups or cycles. They appear suddenly and are characterized by severe debilitating pain on one side of the head and are often accompanied by watery eye, nasal congestion, or runny nose on the same side of the face. A lot of times it can be brought on by stress or tension, or they can even be a genetic factor to these ones. Now I want to do some simple tests you can do at home to check to see if you're having any kind of range of motion problems or any kind of constriction in the neck and shoulder area. Of course, the first one you want to do is range of motion. You can do first lateral flexion, which is bringing your ear to your shoulder. Any problem there? Any problem there? You probably have some problems in the muscles in the neck. Rotation, left, then right. If you can look over your shoulder without having to move, then you have no problem. So if you have to do this, you're probably having pain in the area or constriction of the muscles in the area. Next, you can do what they call the roost test. That's where you hold your hands up like this, like stick them up, and you move your fingers like this for 1 to 2 minutes. If you get any kind of pain or tingling or numbness down the arm or into the hands, what that usually could mean is that you have what they call thoracic outlet syndrome, which is a constriction of the blood vessel and the nerve right below the clavicle here in the first rib. That could be an indication of what's causing headaches. Next is what they call an Apley scratch test. That's where you're testing the range of motion or the mobility in the shoulder. That's where you're going to scratch your back, and then you come up here at the other one and try to touch your fingers together. If you can touch your fingers together, you're probably most likely not having any problem with mobility in the shoulder area. If you can't, you're probably having some kind of constriction of the muscles in the shoulder, which can also cause headaches in the head. Now next I want to give you some really simple ideas to help relieve headaches without the help of any kind of aspirin or Tylenol. The first one is look for trigger points or tender spots on the neck and shoulder area. Usually the first spot I like to go to is right there at the base of the skull. Usually it's pretty tender. You can press on that area, hold it for 30 to 60 seconds, give it good pressure, then let it go. Then make your way down the neck. Usually work in the levator scapula or in the scalenes. A lot of time you'll find that if you're having a lot of tension in the area, it'll feel like a rope or a cord throughout there. Next, you can go to the corner of the scapula where the levator scapula actually inserts. You can press on that, usually right about there. Press on it, rub on it, give it a good massage, and just so you know, the levator scapula is the muscle that lets you shrug your shoulder, helps shrug your shoulders. So a lot of times people's having tension or stress, they start wearing their shoulders like earrings. It's not a good fashion statement, by the way.